right, welcome to the Value Script. Today we have an exciting show for you. Our guest today is owner and partner of Valley Spinal Care. He is a doctor of chiropractic medicine, is an alma mater to one of the greatest colleges in the world, Arizona State University.
That's right.
Is a phenomenal man. He's a husband. He's a father. He's a philanthropist. And he's an all-around good guy. Welcome to the show, Dr. Mike Andreula.
Appreciate you guys having me on. It's awesome. It's a pleasure being here.
Thank you. We've been trying to set this up for weeks.
One life event after another got in the way, and
we're grateful you're here today. Excited to have you.
Yeah, excited to be here. It's awesome.
Very cool. So what made you want to be a chiropractor?
Long story short, basically I got in a snowboarding accident after college during that time, and fell off of a jump. It was actually after the 2002 X Games in Utah. So I went off of the second jump, landed fine. 2 days later, we were back home, woke up in bed, couldn't move my legs. And so, after about 2 months of trying to
all,
like 10%.
Wow.
So like weight bearing was super hard. And then couldn't really feel my legs that well. So after about 2 months of searching from neurologist to you name it type of doctor, I ended up going to my mom's chiropractor at the time. And I didn't like chiropractors because a year before that, I went for my headaches, and not a good experience because obviously he just wasn't a good communicator. So I didn't really understand what he was doing. He just went after it. And I was like, dude, I feel way worse.
Yeah.
Didn't go. So I obviously didn't even think chiropractors were real. And then after about a year of going to this other chiropractor, I gave him a shot. I was able to move my legs within the second visit. Weight bear, get back to doing everything. I went consistently for about a year, and then went from a career change of getting into real estate and going down that route back into school into head of chiropractic.
Oh, that's fascinating. So you actually had real life experience where chiropractic medicine provided a tremendous benefit.
100%. Yeah.
That's interesting. I was going to bring that up just in the interest of being a good interviewer, asking you tough questions. But I appreciate that you brought up kind of how I felt about it, because I kind of approached chiropractic with I have optimism, wanting it to be everything I wanted it to be.
Right.
But not having found the practitioners that actually could help me really believe in that. Because I've left chiropractic offices, like you said, feeling worse. I had neck and back issues. And being a dentist, it's an occupational hazard. 1 out of every 3 dentists will become disabled because of generally neck and back issues. And it's an occupational hazard that we all face. And so trying to maintain and keep healthy spinal hygiene, I guess, I was searching for chiropractors that would help me with that. And man, I can't tell you, more of the time than not, I left hurt.
Yeah.
And so then it cast out like these guys are quacks. Right?
I mean, usually it's due to poor communication. It's due to poor outcome measures, communication with not only the patient, but like, hey, this is what to expect, what not to expect. And then when that happens is then the patient does go home. They are sore. They're like, oh, yeah, he told me I'd probably be a little sore, right? And he probably told me what to do about it. Like those are the key ingredients to a good new patient visit, right? That and not usually adjusting the patient on the first visit and kind of figuring out, in particularly what suits them versus the patient that you saw before them or after them. And that's the kind of the key. I mean, it's all about communication. I mean, I'd say all the time, majority of people come to me, not because I'm the greatest chiropractor in the world. They come to me because my office environment, how we talk, we understand each other as people versus, oh, I'm the greatest adjuster, or I'm the best practitioner. And that's not how I get patients.
Well, the overall experience of going to your office is way different than any other chiropractor I've been to. And I love, like, one of my favorite things is, like, I love that you incorporate the physical therapy in there as well. And, I just felt like the whole experience was different rather than just the chiropractic. Like, it just all makes sense the way you run it.
Yeah, we try to make it a family environment where I know you've been to our clinic, and for those of you that know we listen to pretty aggressive music. We listen to your J. Cole's, your Kendrick Lamar's, any other side of hip hop, anything like that. And it's very loud. It's louder than it should be. And everything's high energy. Everything is positivity. Everything is welcoming. And that in itself separates us. People come in and they see 30 patients in the waiting room. They're like, this is not what I expected. And for 99% of people, that's what they're actually wanting, is someone to provide an experience versus a ho-hum environment that they typically usually go to when they see their MD or another chiropractor down the street, or even physical therapists, right?
Yeah.
And so then we pair that with every service under the moon, not just chiro, not just PT, but full medical and obviously everything else.
What else do you offer? I mean, that was one of the reasons we wanted to have you on the show. One, because you actually made a difference for my wife. And when my mom needed somebody to go to, because goodness, I think she was almost couldn't walk, right? When we sent her to you, I loved that I could refer with confidence my mom to you and your practice because of the results that Meredith had seen as she'd gone through some of her sciatic nerve pain and her chronic pain. And we noticed there's a distinct difference in your practice. It's not just you walk in, you get an adjustment, but you like you said, you have a lot of facets you've integrated. Do you want to speak to that a little bit?
Yeah. So we are a chiropractic clinic. That's how we started. Obviously VSC stands for Valley Spinal Care. Now it's more of just kind of our name is VSC, and it's more medical rehab wellness. So we incorporate full medical care as far as pain management goes, hormones, allergy testing, into injections, joint injections of that sort. We also have full physical therapy now, even more so than we did 5, even 10 years ago, when we just did some basic stuff. Like you go to a physical therapist, they put you on a machine and they call it a day. Whereas now we're a full scale spectrum of, you come in, you're in pain, we get you out of inflammation and pain, then we give you correctives, and we get you actually stronger than you were even before you were hurt in the first place, right? And then we have chiropractic care, which goes into, it could be adjusting, it could be even active release technique, it could be a little bit of neurological kind of reprogramming we do. And then, with that, we take x-rays and we get you going, and they're all digital, and which is great because patients can obviously see for themselves what's up. And then I'm also not popping and praying. That's what I like to say, and people are like, why do I need x-rays? And I'm like, well, just bear with me, trust the process, you'll be okay. And then we also have a regenerative medicine side to our clinic now, that we transformed previously from our outpatient surgery center. And then we recently sold that off and then developed a regenerative medicine space.
Very nice.
Which is where we do some other stuff as far as the IV therapy, the ozone, EBU, and stuff like that.
So pray and pop.
Pop and pray.
Pop and pray.
That's right.
Pop and pray.
We don't like to do that as much as most people do.
Before we get into more of the particulars in your practice and the benefits to how you guys do things, do you want to speak to your story a little bit about your situation?
Yeah. So I started having lower back issues. I don't even remember when. I think
originally it was right after you'd had 2 babies back to back. So you had Leighton and London within, it was a year and 2 weeks apart.
Yeah.
And then it was when London was probably
4th and 5th babies.
Yes.
So when I'm pregnant, I carry very out front. Everybody would always ask me if I was pregnant with twins, because that's how I carry babies. And so
people are brutal too when you're like pregnant. Oh my gosh, sweetheart, you are just huge. It's like, thank you.
Are you sure there's not 2 babies in there? I'm like, okay, it's not the 1900s.
We get that all the time. Like, are you sure you're not carrying twins? And I just want to be like, hey, Meredith, you should like just be totally brutal. Just be like, I'm not even pregnant. What are you talking about?
This is new
How
news.
dare you? How dare you assume? Because people are so freaking bold. I just want to flame them back.
Right.
Anyway, sorry.
But no, you're good. But because of all of that, I think my core was just wrecked. And so my back was taking all of the pressure. And
it didn't help that Leighton, once London came along, Leighton didn't want to walk anymore.
She
wanted to be carried just like London.
Leighton didn't walk till she was 18 months. And so I was carrying 2 babies for 6 months. Like that was ridiculous.
It's wild.
But, so my back just got worse and worse. And it got to the point where like I couldn't walk. I remember like just trying to get out of the car to go to a doctor and just wanting to die. And so anyway, found a doctor that kind of helped a little bit for a little while. And then we met Mike, and Lonnie was like, hey, you should start seeing Dr. Mike. And so I went in to see him, and after a few visits, like, that was great. Like, I was good. And like, I loved like the physical therapy side of it, because you guys gave me things that I could do at home to help manage and like keep my body in a good place in between visits. And so that was great for a while. And then slowly it just got to where that wasn't working. And so I ended up having to have back surgery, which was really like, for me, I had a herniated disc between L5 and S1. And anyway, like, my surgeon told me that there was no way I could have done anything to be out of pain without, avoiding surgery.
Which was kind of amazing to me that she had relief after coming to you, just because when we saw the MRI, he blew it up like, on a big screen, and he was like, the right side, that was healthy, it looked about like it was the size of my pinky on the resolution of the screen. The left side, where the damage was, it looked like the nerve was compressed down to where it looked like a string of dental floss. Right. And he was like, I am floored that you don't have motor impairment, but you don't, so that's good. but he advocated for surgery, and we'd been through, we went through you, and then as her back got more and more degenerative, we actually tried to go to Arizona pain docs. I don't know if we want to flame them outright, but they saw the same MRI that I saw, and me being a dentist knew that some cortisone and some lidocaine and some pain reliever injected in the spine is not going to fix that.
You get the discectomy, right? A discectomy?
Yeah. They call it a laminectomy. They call it a discectomy.
Well, the lamina actually removes part of the lamina of the bone, which is also interfering, so then there's also a discectomy as well. So
it was just a disc.
Yeah. And I had relief that night. Like, I slept through the night for the first time in a year.
Right. After
that surgery, it was fabulous. And so now I just come see you, not regularly like I should, but it's great because it just helps me to maintain just, I don't know, being healthy.
Well, it's movement. Yeah. Proper movement in the body. It's obviously, that's what starts the issues, is improper movement in the body. And so then that's why.
So one thing I did want to ask you, since we did 75 hard and now we're doing phase 1, like, I have noticed, like, I just have some tension in my lower back. Is that because certainly the biggest risk after surgery is herniation. Right. So is that, if I'm feeling that, do I need to be concerned about that?
What I found to be super helpful over the years with a lot of common issues with patients is the more mobile you can get before exercise and the more active, so activating the proper muscles beforehand, exercise should be pretty seamless for you. And what I mean by that is, obviously, I like to look at the hips as your foundation, right? So the more mobility you can get in the hips and the more strengthening in the hips, meaning the glute medius muscle, right? That's your stabilizer muscle. The glute max is what looks really awesome when everyone shows, the peaches and, all the videos on Instagram, right, which is great. But unfortunately, the stabilizing muscles are what's key, and that's what prevents back injury. So when you're doing the lift and twist, when you have little kids, or whenever you're doing a high intensity workout, or even running of the sorts, if your stabilizing hip muscles aren't there, the low back's going to keep compensating towards that affected hip. So I always recommend, let's do some hip flexor stretching, keep the hips from rounding forward, maybe a 5-minute foam rolling sesh, right, on that favored hip, where you work the glutes out a little bit, you work the quads a little bit. And the reason those are huge is because quads will pull the hips forward, right? And
so you're saying, like, do that before I do squats or like 100%. Lifting, or
get on the foam roller, knock out some foam rolling a little bit, maybe grab some bands, activate those glute medius muscles, and then go do whatever you want to do. And then afterwards, proper hydration, which is key, which you don't have an issue with now because you're doing phase 1. And I'm still a big fan. I know they talk about the ice and the heat. I'm still a big fan of knocking out any sort of inflammation. Yes, the ice is going to make those muscles feel tense, but I'd rather them feel tense than not pain and inflammation. Does that make sense? That's why you're seeing all these people with these cold plunge pools, right? And you're seeing people with these cryo machines. Well, if cold was that bad, these things wouldn't be helping people. And that's why I'm not a huge fan of the heat, because heat then also brings up more inflammation in other latent areas that there might not have been, right? So, yeah, I mean, those are super easy things you do, and it literally can take 3 to 5 minutes. And that little bit of activation causes a huge difference in kind of the way your body's going to move at that time.
Nice.
So, a couple questions I've always had. I've always wanted to ask a chiropractor.
Yep.
One, how does, popping and praying, like, how is there hope that does anything?
Well, there's not a hope. It's a physiological effect, right? So you have one spine, and the spinal cord goes through the whole spine of the vertebrae, right? And then you have the nerves that come out from the foramen, those holes you see on the spines, right? And when I move or adjust or whatever you want to call it, manipulate the spine in that area, what it does is it hopefully, depending on the chiropractor you're going to, realigns the body back into its normal homeostasis, what it should be, right? And then allows the body to kind of heal itself with that motion, right? It's kind of like taking a foot off of a hose, right? The hose is going full. You put your foot on it, what happens? Water's drizzling, barely coming out. You take that pressure off the hose, it starts working again. Same thing with the nervous system. The segment that I'm adjusting got out of place because of, who knows, thoughts, trauma, toxins, anything to the body. And my job is I'm basically a facilitator. I put it back where it needs to be. Magically, the body knows what it does. That's what the popping is. The popping is also gas within that joint space. I can adjust your spine without it popping, and it still does the same thing. But now people love the videos of people getting cracked and traction and everything. And even if you look at my Instagram page, I've fallen into it too, and I do it as well. And they're probably my most liked videos is me popping people. But
that head contraption.
But yeah, people love that thing. I don't know why they love it so much.
It looks terrifying.
it's super easy, but yeah, that's the whole basically mechanism is you're transforming a spine. Now, why do you have to go back? It's very similar to, and I always align it up with dentistry, right? You can't just brush your teeth for the year and then magically you don't get plaque and cavities don't develop. Same thing with your spine. You got one spine. You don't even have two sets of spines, like even dentistry has. And so you treat it right. So that's why sometimes it'll take, 4, 6, even 8 adjustments to get the muscle memory back, just like a muscle memory of working out, right? We work out, we get hypertrophy goes away. Hopefully we got a little stronger. We keep repeating the process, right? That's how we get larger muscles, more toned muscles. Same thing. Back is the same thing. You have muscles along the back. It'll pull your spine a different way. And like I said, thoughts, trauma, toxins, those also affect how your body's going to represent. And so, yeah.
And do those also create a muscle memory in like a pathologic state?
100%. So that's how disease happens. That's how things happen.
So that's why you got to go back too, right?
Well, you go back until now. That's the thing is people go back. Some people do, well, how often do I go back? Well, how active are you? What do you do for a living? Like, what are your goals, right? Like me for, my life, I don't have to go back as much. I've been getting adjusted for 15 years now. Like, it's cool. Like, I hold an adjustment a lot longer than most people. People that are sedentary and they sit at a desk all day, yeah, we're probably going to have to retrain your spine a little bit. People that are high impact, like CrossFit athletes. But yeah, the desk, that's huge to combat because someone's sitting at a desk for 8 hours a day and they have high expectations. Like my one adjustment a week is going to cure them of everything. It's like, no, this is a process.
I don't think that's ever been explained to me that thoroughly. Like when I've gone to a chiropractor, it's like when I come back 30 days, like come back next month, and just, it's like a once a month thing forever. And it's kind of like, well, what are we accomplishing? I didn't, and again, you went back to your main point of communication being so important in receiving and having this type of care being as effective as possible. Is you need to know what to expect as a patient. And so I think that's another thing that sets you guys apart in your practice is you give the patient the correct expectations and the anticipatory guidance of this is what you can expect in the future. And then, like you said, it's not like when we're like, well, how often do you come back? It's based on what we need rather than, well, it'd be nice for my schedule and my budget if you come back every month.
100%. And to lead into that, I mean, it's just not even my communication. That's my front desk. That's my biller and everyone's communication. And that is, my opinion, my desk, my office, I mean, they do the job for me. I have 100% confidence that I know exactly what's going to happen at that front desk, what the scheduler is going to say and everything. And that's the benefit of the cross training, the efficiency we have is there's no, oh, I owe this money. There's no magic things that happen, you know, when we do things. So that's why patients are more amped to come back, because we're very truthful. We're honest, and everyone has integrity, and we do the right thing. So when they come up and I'm saying, they're like, hey, Dr. Mike did say he wants to see you for the next, month, but only once a week. And by the way, this is what to expect. Now they're not going to not show up to that next appointment because there's not going to be no catches at the end. It's not like, oh, now we're going to bill you. You know what I mean? Like we are very upfront with all the information.
You help the patient become part of driving their own bus on their own healthcare. Right?
Yeah.
You help them understand the need and then help them understand the tools that you have available to offer them and why they're important and how to implement them. And then also give them a plan afterwards of how to maintain and do that.
Right.
And your staff is fantastic. Like,
oh, they're great. I mean,
they're so great. All of the physical therapists, the front desk, everybody is fantastic.
Yeah, and the best is it's a self-managed system. People are like, oh, you do a great job of hiring. Well, what you guys don't know is we used to hire everybody, right, until we got our foundation. And now it's about leadership, creating that leadership. So everyone you see that's not a practitioner, whether it be a PA, MD, or something like that, that's hired from people in my staff. And we trust them to implement, obviously, our culture to those. So we're self-regulated people. So if something happens, well, that's on them, and we're going to figure it out as a team versus, well, you hired that person and they don't fit. Well, no, so that's why we do very well. And that's why it's a very family-like atmosphere, is because we treat our employees, well, just like we treat our patients, and we create that synergistic relationship with our, and that's why we call it our VSC family. When patients come in, that's what separates us apart, is we know they had an anniversary. We know they had the birthday. We know they went on their trip to Cabo. We know everything. And the only reason we know that is because we ask questions, because we actually give a shit, which is what I want there to be in our office, which is super cool. And, like I said, it's all built on culture. So they make me look a lot cooler than I am. And that's the goal. I'm cool with them taking the credit for that. Like, I don't care. Like I told you in the beginning, like, I'm not the best chiropractor in the world. I'm good at getting people better and getting them nice, but I don't have to be the best provider. My goal is to be the best strategist person to get you in the best situation for your, situation that might be, right?
Absolutely. One, I think that does speak to your excellence, because even as a dentist, and from my standpoint, there are things that I can do, but it would be better if a specialist did it. Like I could do it, but it would, you'll heal faster, you'll have better treatment outcomes, and it's actually better for you to actually listen to my full faith referral to go see this oral surgeon or to go see this endodontist, because putting people in the right place for their care rather than being selfish, like, well, that's $1,000 I could bill myself, and yeah, I could do it to the standard of care, and it would probably work out, but am I really the best person for the job? And I appreciate that you approach it that way, because it resonates with me.
Oh, I mean, that's why you're doing so awesome with your clinics. So,
you have this integrated machine. You've been able to create these systems in your practice that you said are pretty like almost self-fulfilling and self-propagating. Is from anything from like how your practice runs, from the day flow of the patients, from how it feels in the culture, to even finding new talent to add to your team, right? But it wasn't always the case. I read an article about you before you got here, and dun dun dun. And well, you spoke to the fact that it wasn't always that way.
No, it wasn't always that way.
So how are you able to tell us a little bit about before and what the pivot was?
VSC, or Valley Spinal Care, has been around the Valley for, I don't know, I want to say close to 17, 18 years. It was owned by a guy named Sean McGlure. And it was strictly basically chiropractic with minimal PT put in place. And then kind of purchased through another guy named Dr. Josh. And then from there, Justin, who's my business partner, Justin Pierce, he's on Instagram as Bowtie Doctor. Him and I kind of one way or another, we came into the practice together where he was developing his practice, I was developing my practice, and we essentially bought in, and then we bought everybody out, and it became ours. And we didn't know each other. But he's the opposite of me. We like a lot of the things together, but he's a very excellent communicator.
Hey, can we silence all phones in the background, please? I mean, Judas Priest.
No, but yeah, Justin, he's a big personality. We're very similar in that aspect, but he's a good communicator. He's outgoing, and I was more the dictator type, serious role. And you put both of us together, we kind of developed something really cool because we had the same goals, right? We wanted to be the best. We aspired to be the best.
It's kind of the yin and yang thing going on.
Really, really much so. And people were like, well, how'd you guys find each other? And we really didn't, man. By God's grace, we got put together and we're like, this actually works. And so from there, we realized we had to change some things. You know, the last quote unquote boss that was there before we came in was very much a dictator. He was hated. He was respected, but he was hated.
Sure.
And we all know that that's not how the best companies are run. And I was able to figure that out. Justin was able to figure those things out. And we just kind of came together and was like, hey, we need to change the culture. We need to change how things are run. We need to make this that, you know, our goals of this clinic fit into other people's goals for what they want in their life, right? Give them responsibility, give them leadership roles.
Oh yeah. I mean, so you're talking about your employees, not just your patients. You're talking about people that work with you.
I'm talking for the people. That's how we changed it.
Yeah.
I mean, we started hiring people that are like, hey, what do you want to do? Right. So to give you an idea, Bobby, who's my office manager / biller, he's kind of like the guy that runs the show of everything. He started out in our PT room. He went from PT to front desk to assistant biller to basically we were just like, listen, and we kind of grew him from there because we have these conversations with our employees. And we're like, what do you want? What do you want in life? Like, does it fit here? Because if it doesn't fit here, then how can we help get you somewhere else? And once you start having these hard conversations with people, they take value in you as your leader. And you're able to kind of change the culture slowly and one by one. And it was difficult at first. I mean, we were a profitable clinic, dictator ran, and if you didn't like it so long, and we had turnover all the time, and I almost fell into that trap. And thankfully that Justin and I met, we were able to kind of take the best out of each other and grow it to what it is.
That's awesome. It sounds like, you know, I know you've heard Ed Milet say this as you were in the same room as me when he said it, but it was, you know, build your tent big enough so that all your employees, all the people that work with you can realize their dreams within the tent.
Correct.
Or else they'll leave. They're going to go find where they can live their dream. So you need to figure out a way for them to live their dream under that tent of, you know, of your business or the offerings that you bring to the world, what you're creating.
Yeah, we had to find that out the hard way. We found that out the hard way, and then we didn't. You know, actually, you know, Andy was introduced to me by Justin. Really? He started listening to this guy, and I'd hear it in our office. I'm like, what the hell is this guy even talking about?
This MFCEO guy.
Who the heck is this guy? And I'm like, this guy's loud and obnoxious. And after about 2 minutes, I'm like, dude, this guy's great. And he's like, yeah, what I've been telling you. And so that was back in like 2015, 16. So we've evolved quite a bit. Patient base has evolved quite a bit as far as how many people we see in a week to a month is pretty awesome. And I'd say
you guys are fairly aggressive in your scheduling, yet you're still able to provide a high level of customer care.
Yes. I mean, if you look at get that dog's cruising.
What are we doing? Oh, our guard dog, our kids just came in from the backyard. All right. Hey, Dr. Mike, really appreciate this valuable content we've been able to have so far, but I feel like there's so much more to this conversation I want to have and continue in the next episode. So we're going to wrap it up right here, folks. And don't forget to stay tuned to the next episode of The Value Script.